we move now to Israel, and we move to a project where I'm a partner of, and where we had some very exciting activity happening in spring, and Yael and Muli will talk about that. Muli, you can also start your camera, and Claudia, can you switch yours off, please? Thank you very much. And without further ado, I stop my slide, and everything is for you.
Okay, great. So I'll pull up the presentation first. Do you see it? It's not fully. Do you see it now?
Perfect.
Okay, great. So we're glad to be here to present our project. I'll take a few minutes just to describe what the project is, and then we'll kind of narrow in on what we did, which was here related to internationalization for society, and how we kind of focus beyond our student population within our faculty, which is the target population of this project, and how we expanded it beyond that during the time of COVID. And really here, I feel like COVID is something that we're now living with, but this project took place really within the first 2 weeks of the pandemic. And it's kind of when it arrived in Israel. So I'll start just by introducing William is a capacity building and higher education initiative. It focuses on internationalization at home. These are our partner institutions. We're 12 partners. There are 10 institutions of higher education. Hi, Muli. 7 of which are in Israel. We have 3 partners in Europe. And then, as Uwe said, the Global Impact Institute is a partner, and ESN is our partner as well, which are our support that are not the institutions, but bring their expertise in different ways. The project in general, under this kind of big umbrella term of internationalization at home, which got a really big boost in the past year because of COVID, we focused on 3 things particularly: creating an international learning environment for home students, working to address the needs of international students studying in Israel, and then the social integration between them. And I would say the initiative that we're going to present to you today took place mainly within the framework of working to address the needs of international students studying in Israel. At the time, 7 of the institutions clearly had a lot of international mobility, students on campus, worried parents at home, needing to think about how to address their psychological issues, giving them the support that they need. And from there, it went to beyond that. As Muli will share, because of the expertise that we had in our partnerships in William, we were able to provide a better psychological and social support for those to also beyond the project itself, beyond the students, beyond the international offices that we partnered with. I'll just say also, we have here in our audience also Yoni, who is from Hebrew University, and he's also a partner in William, and so maybe he'll also address, if there are questions, you can also address them. Just some background about where we started from. Our institutions in general were lacking training for how to work with international students, both from the faculty side and also intercultural issues related to international students. This was just a mapping that we did of our institutions. We saw that the overwhelming majority really said they had nothing in place in this way. And that's because our institutions, although we have some big institutions that participated, like I said, Hebrew University, a lot of us were small institutions just starting our internationalization tracks. So we really had to put a lot of effort into the very basic work with international students. We had half of our institutions, especially here, the yellow ones are the ones in Israel, meaning of us, 5 of the Israeli institutions did not have protocols and procedures in place for international students. And you can imagine how difficult that is at a time where suddenly there's a pandemic, and now you have to see, how do you react? How do you work with the student? How do you work with the home institution and provide the support that you need for them? We were very lucky, though, that right before the pandemic, actually on February 4th and 5th, we had a safety and security of international students workshop. And there we had all of these issues. Like, what if in Israel, we unfortunately have security issues that have to do with at times missiles or terrorist attacks. And those were the scenarios that we were planning for. A pandemic was not the one that we had on our mind, but we were working to think, what do you do in these situations? What kind of support you need to provide? And lo and behold, on February 21st, the first case of COVID was in Israel. And from there, I think all is history. But what it did is it gave us the infrastructure already in terms of our partnerships and understanding of safety and security, and who in each institution knows has more knowledge, less knowledge, who could provide more insights. It gave us that framework to then be able to react quickly when we decide to do a COVID initiative. The COVID initiative was to target international offices, institutions of higher education, not only in Israel, but around the world, international students, parents of international students, which it was an interesting debate for us because one of the things that we understood, particularly in Europe, is that international students are adults, and so you don't need to deal with their parents, you deal with them. But in situations such as this, where there's a pandemic and people were very concerned, the question is, how do you offer support beyond that? And in general, right, the psychological situation of most of the people in the community was very uncertain. And could we provide additional support for the wider public in dealing with the situation? And we had this, as you'll see, we had the team in place to be able to do so. So we'd say the larger audience that benefited from our website and from the material that was produced is anyone interested in learning more about coping with uncertainty as a result of COVID. The partnership that we already had in place, because we were dealing with safety and security, was between the Community Stress Prevention Center and the William Partner institutions. Muli is part of, Professor Muli Lad is part of the William Partner institutions, but he also runs the Community Stress Prevention Center. And as he'll describe, right, they have the expertise to really take this on and work with us to create a program that would benefit not only students, higher education institutions, but also beyond that. So I'll pass it to Muli to discuss a little bit about the center and how the partnership worked, and then give you a taste of the kind of information that was passed on.
So you're going to control the slides,
yeah.
Okay? Because
yeah.
I don't have a control on the slides.
Right.
Okay, so just briefly, thank you very much for introducing me. And of course, I'm very happy to be a member of this project. It's a very, very exciting one. Just a very quick update. We are now working on a learning kind of project that will enable those who will be willing to use the safety and security project or package. So it will be a much more interactive than you know, a document that you read. So that will come. So what is this Community Stress Prevention Center? It is a very long-standing organization in Israel with, as you can see, lots of staff, very varied in the area of education, psychologists, social workers, etc. Over the years, I myself have published about 35 books and hundreds of articles on this subject of coping with crisis and disasters. And our main focus is, of course, resilience and empowering by training local trainers around the world. Next one. So that will just show you, that will just give you a brief idea of where we are working around the world, where basically since 1986, we are involved in most major crises around the world. And that means not only in third countries, but I mean third world countries, but everywhere in the world. Let's move on. Basically, what we offered to the William site here in Israel was guidance for the international offices by, first of all, looking at what have happened around the world, not only with our partners, so that we'll have the best place for people to come for Q&A. We addressed, of course, the offices, the students, and the families. And so I would like just to share with you what we have taught our partners here, and it is part of what this concept of international students safety and security concept. Basically, can you move on? Basically, we were looking at what is so special in the what we call uncertainty and the fear of no control that we are all facing with this COVID-19. So we are coming from a broad perspective that says that we, the human beings, are very, very, I would say, vulnerable creature on this planet. Probably the only one that has a future distance view, which includes, unfortunately, the idea that we will not be one day. And that's why we have to create an inner system or concepts that will help us to move from yesterday to tomorrow to feel some certainty. What is the main mechanism, of course, is avoiding this concept of our finality, though we are aware of it. So there is a kind of a game between our awareness of our end and what we do in order to still work on an everyday basis. Now, it is not something that people are taught or that we are taught for, but it's something that develops inside us. And unfortunately, COVID-19 was very, very powerful and still is to bring the awareness that our finality and death is something that is around the corner. It's interesting because people in the world usually, based on a very, very good research by Janov Bullman already in '92, we all hold such a basic assumption that the world is fair, reasonable, and if you do the good things, you will inherit good things. But you see, we also know that bad things happen to people. So how do we manage that, especially now that so many people are suffering? We're actually using what we call the bridges that leads us to go from yesterday to tomorrow, and we are using 4 concepts that we have found to be very effective both for individuals, systems, and even of families and systems, and even big organizations. We call them the cognitive, role and function, social, interpersonal, and personal historical. The cognitive one is all the things that we know about the world, the rules, the norms, the routines. The role is the role that we keep on managing and doing on a, first of all, we were born to some of the roles as sons and daughters and kids and partners, etc. But we also have our roles as faculty and also the students as students. We have the social and interpersonal continuity, which all the relationships we have with family, friends, colleagues, etc. And we have another continuity that holds together. I mean, all the 4 are combining this sense of continuity. And the personal one is all the things that we believe about ourselves. It's our optimism or pessimism, our self-esteem, our belief system, religious and otherwise. Let's move on. So what we have found is that these, as you can see, these are the summary of what I just said. These are built, I would say, spontaneously without any intention by anyone to teach us. It's something that helps us to feel safe in the same time that we all know that everything is changing all the time. But we human beings hate changes that are imposed on us, and we don't like to feel insecure. Let's move on. What have happened with the COVID-19? It basically impacted, if not broken, all those continuities. If you just look at them, the cognitive realistic one, we have changing laws, procedures, no previous experience, and we have disrupted routines all the time. Our role and functions, roles become irrelevant, people were laid off, dismissed, and people who have to work from home and teach from home, especially as we're talking about faculties and students. Suddenly we are kind of intruding their personal space by teaching them at home and seeing their kids coming and going or their partners, and all those things have changed our ability to function as we usually do as teachers with students, etc. And the most, of course, impacted one is the interpersonal. Go back for a moment. Is the interpersonal and social one, because of the isolation, remoteness, contact through screens. All of this very important aspect of human safety has been completely shattered, or at least very, very seriously impacted. And people don't really know themselves. They suddenly feel all those sentiments and physiological symptoms that they were not really facing on a daily basis. The COVID really have changed all the things that have helped us in the past to move from yesterday to tomorrow. So the next question was, how do we cope with that? Because this is the map. This is help, by the way, it helps offices to see where do I have to work more closely. Is it the realistic and cognitive aspect that is not working? Are people not knowing what to do in the role? Is it the interpersonal one? It's very important because once you map it, you know where to go. Let's move on. So how do we cope? We have been working on coping since 1980. We started with this study already in 1980, and we continue to study the way people are facing and living with prolonged crisis. Most of my studies around the world, and of course also in Israel, as you could see in the map earlier on, is based on big crises and the prolonged process to recovery. And this is a question for you. Just look at this and ask yourself, because we are okay. In a minute, I will finish. So just ask yourself, what sort of activities or things are helping you? Because basically, as we move to the next one, you will see that if you have Yael, can you move on? If you can see the map, it will tell you that basically we are I would say we don't have any other choice but to cope from day one. And basically we call this a model basic pH. That means some people will tell us that they will use belief system, self-esteem, etc. Some people will tell us what helps me to function is my affective mode. That means expressing my emotions. Some will be relying more on their family and surrounding, and also taking a role and being responsible for something. Some people say they're using their imagination, their fantasy, humor, doing creative things to feel some sort of safety. And of course, there is the cognition that those people who are looking for information, data, making a priority list, etc. And of course, the last one, the physiology one, is people are saying, for me, it is doing things, is being active, or doing something to relax my system by Tai Chi, yoga, meditation. And of course, here comes also food and alcohol, etc. The main concept here is that we are not judging if it's right or wrong. We're only checking with you if it's helping you. If it helps you, that's okay. If it is ineffective, then we'll teach you other modes. Now, most of us have more than one channel of coping, as you probably have seen before. I believe I'm coming to the end of my presentation, so let's move to the next one. And that's basically the end of our presentation. I hope we. Well,
I'd like to add a few words to it, Muli.
Yeah.
And so I want to say also in terms of this is the kind of thing that was presented on our website through, there was a Q&A that any institution or person could ask a question, and we would have the team of experts be able to respond to them within a short period of time. This is the training that was given also through various texts in Hebrew and in English to international offices, so the word would spread. And I would say, like, it may sound like it's not a big thing now, but if you take the context that this was within 2 weeks of the pandemic, where everyone else was just trying to figure out what to do, we were able to use our platform to help, right, beyond our local network, I think, in a meaningful way. I mean, now I think there are lots of resources and thought about, the need to give psychosocial support and how to deal with it. But I think at the time, this is an example, not of a project that set out to engage society or beyond the institutions of higher education, but because we had the team in place, because we had the partnerships in place, and we had, we were able to leverage that in order to be more useful to people outside of the project. That's why we also translated a lot of things into English, where we would have, if we were to keep it local, it would just be in Hebrew. But beyond that, beyond the doors of higher education. So I think this is an example of how a project can work to help society when the the infrastructure is in place to do so, even though we didn't necessarily set out to do that as a goal when we started the project.
May I just add one more comment, is that what we're actually trying to teach international officers, that when they speak to a student, they can actually trace the way they cope by asking them what is helping you, and through that and help them to focus more on coping than on distress. The main issue nowadays, I must say, is two other aspects that we are now studying and trying to develop a program for, and that is, one is the rage. People are so angry on the one hand, and on the other hand depleted, and the depletion is leading to what we call learned helplessness. And we're again trying very much to develop methods on the individual and system aspect to help people to reduce their rage and alleviate this sense of helplessness, which is very, very common around the world.
Thank you very much. As I somehow it developed that I became the question host, as I call it, for the different sessions. Somehow it becomes quite lively with that. So what I would like to do before I go into a question that is already posted, which we can discuss, I would like to go to the last point that you, Muli, mentioned, rage. We've seen that now a lot in COVID, right? And the more that people are restrained in physical mobility and etc., and kind of restrained to their home and losing all the things that are valuable to them in engagement, that the rage is rising all over the world. In which way would you say did the things that you did already, or we did together, all of us, but mainly it was your work, right? What you did in the project to disseminate to the public, did that already somehow, did you have feedbacks that it helped people? Even if it was not focusing on rage at that point?
I must tell you that I am amazed to the number of emails and WhatsApps I'm getting, at least in Israel, from all over Israel, but also from abroad, on how helpful it is, because we just gave people a map to understand what happens to them. I mean, it was a shock because we never experienced, of course, there is a history, but even in the distant history, not all the world was in the same, I should say, boat or same problem. And people are confused. So the first thing was to give them information, give them some sense of what to focus on. And the second is, because all our I would say, pamphlets and advices were very practical, people find it to be something that they can use. As for the rage, I believe that we are also, all of us, dealing with the age that rage, it sounds like age and rage.
The age of rage.
Yeah, rage is a very, very common reaction, but we also need to look very carefully to those who are getting into this helplessness, which is another, the other end of the continuum. And for both, I think that as much as we can maintain collaboration and maintain dialogue and give them the sense that we are not overwhelmed by these reactions, but we are expecting them as normal reaction to this crazy situation, and at the same time trying to lead them to be active, not raging, but active. And it could be on so many levels. I mean, the basic page is just one map to give people the idea. It could be praying, it could be sports, it could be to be with friends, etc., etc. And we are creating, at least in our little part of the world, corner of the world, so many kind of events that helps people to feel that they are alive. I think this is the most important thing, because we are a social entity. Human beings are in need of others, mostly because we are such a vulnerable creature, though we are the rulers of this planet.
Yeah, thank you. That leads right away, when you mentioned the WhatsApp reactions, etc., to the question we have here, which is a question by Yael Kaplan, who asks, have you received any feedback from institutions outside Israel that applied the information or the principles presented in the COVID initiative? Can we learn something from this process of dissemination? given the fact that this was an attempt to deal with a universal issue that is being treated differently in different societies?
I believe that Yael can answer that better than me. I can only say that our plan was to also develop an online teaching process so that offices could assign a person that will learn how to do it and not just read the instructions. But I'm leaving it to Yael.
Well, I would say, I think we got feedback from some of the institutions that work with us that they're implementing it and they're sharing it more widely. We did not get a lot from other institutions beyond our partner institutions. And I think part of it is because we didn't have a platform that was very large, and people wouldn't have thought for a website that deals with internationalization at home to suddenly be able to give advice of this nature. So on the one hand, we were set up with the right team in place to offer such insights, but someone who sees our website would be kind of surprised to see this is the kind of information that we're offering. So at that time, we didn't get a great deal of feedback, though I think the information, is, as Mulia said, is one that was very useful for those who could access it and see it at that time, especially I think our Q&A questions and answers. Like Mulia said, were very concrete and practical, right? What does it mean to be living in isolation right now, right? When we were not used to it yet, right? I think we all recall, right, thinking to spend an entire week at home without leaving your house was shocking now, and now we're just happy that it's only 1 week and not necessarily months and months. So I think that there was the practical information was being used, but we weren't bombarded by institutions that.
Well, I would also like to, I mean, as a partner in the project, 2 observations from my side on that. The one thing is, of course, that this was a project or basically an ad hoc initiative that was taken, which had 2 sides of internationalization. The one was that we said, well, as we do it also in English, there is the hope that somebody outside Israel can also benefit from it, but it was not the key. The key was also that we said, well, we deal with internationalization at home, but that also means we deal with the international students who are in Israel. Now, these have also somehow to deal with the closing and with the neighbors. And we have all the people in Israel who have maybe to understand that there is maybe somebody sitting next to them in an apartment who comes from Bangladesh, Germany, United States, Colombia or something, and is alone. And to understand how this person might feel can help other people to do that. And of course, these activities are hard to measure or follow because it doesn't mean that people come back to us. But what I can at least say is when I posted it on LinkedIn, saying this is an initiative that is taking in the project, I had a lot of reactions from universities around the world who said, now that is interesting, we look into that. But I think a true impact measurement in that sense would be too much to ask. I think what one can just say is, if one sees a problem and one acts fast, what you can just do is do your best. And I think that was a lesson learned, that we could just launch, you could launch something out of nothing within a minute. And I think that was something that was really helpful. We have another question from Svetlana from New Zealand. She asks, in your view, which concepts of psychology may be applied to or useful for internationalization at home and IHES?
I can say that there are plenty of I'm coming from applied psychology, although I'm a medical psychologist. I'm coming from the applied science, and there is a lot of things that we can use. I think that the main thing is to try and be empathetic. That means the problem is that we tend to decide that the way I cope is the best to cope. And I think that once we help people to understand that is very important. The other thing is very, very simple. There are 2 interesting laws in psychology, which we don't have so many. And the first one is the 7 ± 2 that I keep teaching people to go back to that. This is a perception concept that we human beings can only
you only have 1 minute, just to say.
I would say we can only absorb few things at the same time, although between 5 to 9. And I encourage people to find the 5 things that makes them feel alive and cope. And once they find them or focus on them, being aware of them, keep doing it. The other one is even more quickly. It's the 50 number principle. We can keep in touch really intimately with about 15 people. So find the 9, 8, 5 people that you really need to be in touch with, and make sure that you do. These are very, very simple 2 psychological, I would say, rules or concepts that we can use every day to, I would say, fight this sense of isolation and uncertainty.
Thank you so much. You really made it on the spot.